Good afternoon. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. Welcome to today's webinar on combating the surge of respiratory viruses in our community, presented in collaboration with Friends Health Connection. We are pleased to be joined by Dr. Ronald Nahass, an infectious disease specialist who is the hospital epidemiologist at Robert Wood Johnson University Hospital, Somerset. Within the state of New Jersey, and especially Somerset County, many individuals are reporting respiratory illness with symptoms ranging from congestion to nausea and vomiting. Is it COVID-19? Is it RSV? Is it the flu or something else? We'll explore those questions and more during a moderated discussion with Dr. Nahass. Dr. Nahass, thank you again for joining us, and as always, helping to keep us informed about respiratory illness and how we can protect ourselves and our families.
Happy to be here, and thanks for having me.
So can you start us off by telling us what is the trend you are presently seeing in the county and state?
Well, what we're seeing now, and we reported on this at the hospital last week, is that the respiratory virus season, as I like to call it, where we see influenza in particular, but other respiratory viruses, colds and flus, is seeming to start earlier this year than in prior years. And so in the past couple of weeks, the numbers of cases of influenza, the numbers of cases of respiratory syncytial virus, which has been in the news, have really started to climb, such that this past week we had more cases of influenza positive results at the hospital than we did for COVID-19. And that's the first time I've actually seen that in the past 2.5 years since the COVID pandemic began. So it was really a pretty dramatic turn of events.
So I know you mentioned a few, but what are the types of viruses that are being reported?
Well, the two main ones that we're seeing and are hearing about in the news are really three, I guess, are COVID-19, which we all know, influenza, which we all know and we've dealt with before, and then RSV is how it's abbreviated, known as respiratory syncytial virus. Those are the three top viruses that we're seeing. We're also seeing a smattering of other viruses. So the COVID-19 disease is caused by SARS-CoV-2. It's in the family of viruses called coronaviruses. There are other coronaviruses that cause colds and flus. So we're seeing some other coronaviruses, not the SARS virus. We're seeing adenoviruses, and we're seeing rhinoviruses. So many viruses that affect humans are circulating now, and circulating at levels that we haven't seen them in a very long time, since really before the COVID pandemic began.
Wow. Well, now, and thank you for explaining and elaborating. For the audience, can you maybe explain the difference between these respiratory viruses, like the difference between COVID and flu and RSV, for example?
So it's really difficult actually to tell clinically, so that when a doctor, a physician's assistant, a nurse practitioner evaluates a patient who might have a runny nose, a sore throat, a cough, a fever, it's almost impossible to tell by talking and examining a patient, talking to a patient and examining a patient, gee, you might have this virus. Because so many of those symptoms overlap. And that's why we call it respiratory virus season. These respiratory viruses all cause that same constellation of symptoms. So you feel kind of crummy, you may have a fever, you may have a cough, you may have a runny nose, a sore throat, nasal congestion, and you just kind of want to stay in bed. That's a respiratory, generally it's going to be a respiratory virus. Which one it is, we can't tell. Now, there are some features that may lead you to think of one more than another. For example, RSV is, pretty well known as a cause of a lot of trouble, particularly in very young infants and babies. And so a lot of asthma or difficulty with a lot of coughing in a young infant might suggest RSV, for example. Influenza has a tendency to cause much higher fever than the other viruses. So if someone was presenting to a doctor's office with a temperature of 102, 103, 104, that was sudden in onset, that might suggest influenza if it was associated with a cough and fever and nasal congestion. So those are some of the clues that we use. But most importantly is the testing. And the testing has really gotten great over the last several years, in part as a result of COVID. And we now have the ability to do a PCR test, which we're all familiar with because of COVID, that actually distinguishes each of these viruses. And so when we do that PCR, we actually get a report that shows us, is this COVID? Is this influenza? Is this RSV? And so that's really the tool that we're counting on now to help us with that.
Okay. So out of all these viruses, which respiratory virus poses the greatest threat to the community and why?
Well, I would say at the moment, the three that are the biggest concerns continue to be and have been concerns in the past, right? So COVID continues to be a concern, and we still nationally are seeing 300 to 400 deaths per day. That's still a pretty extraordinary number when you total it up. Nearly 90,000 deaths a year from COVID still at the rate we're seeing it. So it's still an important virus, even though we're not overrun in the hospital by COVID. It's still contributing, and we're still averaging, 10 to 20 patients on any one day who might have COVID in a hospital. But influenza had taken a holiday during the last 2.5 years because of COVID, actually. And the reason that is during COVID, we were all very particular about where we were going, who we were associating with, whether we were wearing a mask, what our social distance was. All of those things kept the levels of influenza and the levels of RSV at a very low level. Now, all of a sudden, we've got a lot of both of them. And influenza is a bad disease, and it makes you sick. It can cause secondary pneumonia, and it can lead to death. The average number of deaths from influenza on a yearly basis are somewhere between 20 and 40,000. But in a bad year, 500,000 people, up to 500,000 people can pass away as a result of influenza. So influenza is a bad disease. RSV in children, we've heard about that story over the last 2 months. A lot of the pediatric ICUs across the country and in New Jersey have lots of admissions because of very sick children with RSV. So that's a really serious disease in children as well. So each of these viruses have serious consequences that we have to be vigilant for and be aware of, because we're going to be, struggling to take care of these patients over the next several months.
Great points. So now, like the coronaviruses, can these other viruses mutate? And if so, what new variants are concerning and why?
So we're actually pretty familiar with this. We all know that, for influenza anyway, we all know that you got to get an annual flu shot. Part of the reason you get an annual flu shot is because the influenza virus does mutate. And each year, scientists have to study which virus is circulating within what region of the globe. And then they make a decision based on what variant is circulating as to how they're going to produce the vaccine to try and stay one step ahead of those mutations that occur in the influenza virus. So indeed, your question is spot on, that viruses do mutate. It's not just the coronavirus. Most viruses mutate. And depending on the nature of that virus and its interaction with human beings, those mutations may be critically important. So for influenza, mutations are very important. For coronaviruses, not just the coronavirus that causes COVID-19, but coronaviruses that cause other colds and flus, those mutations are very important. And so, mutations occur in these other viruses, and they can put us at risk because our immune protection isn't cross-protective against all of those variations that can occur.
Now, you mentioned risk, and I know a little bit before you talked about RSV. Risk tends to be in young children, but for all these viruses, can you talk about who's at risk for each and what are some of the common risk factors?
So for all respiratory viruses, including COVID, the risk factor profile, those at greatest risk, tend to follow the same pattern of risks, if you will. So People who have chronic lung disease, if they have COPD, chronic bronchitis, emphysema, those folks are going to be at risk. Older individuals, particularly with influenza and COVID, are going to have lots of risk. Recently, RSV, because of our new PCR technology, is being identified as an important risk for making people with emphysema and COPD particularly ill, should they get that virus. So again, underlying lung disease, particularly in older individuals, for virtually all of the respiratory viruses, is a real important concern. And likewise, very young age is a real important concern. So RSV and influenza both have significant impacts on younger children, neonates, infants, should they get those viruses as well. And then obviously people with compromised immune systems also have increased risk. So if you have cancer and you're receiving treatment for that, or you have leukemia, or let's say you might have needed a bone marrow transplant or a kidney transplant, those individuals would have increased risk as well. So the same groups that we've learned about within COVID-19, it applies across all of the respiratory viruses relative to risk and danger to individuals.
Okay. So now I think earlier you mentioned too some of the signs and symptoms. So if you could just expand upon what are some of the signs and symptoms that individuals should look for with these respiratory viruses?
Again, I think we talked about this, but the challenge with respiratory viruses is that the symptoms, the signs and symptoms are really very much overlapping. So, it typically might start with a scratchy nose, an itchy throat, a sore throat, and then progress from there to involve sneezing, coughing, fever may develop. And in particular, certain viruses are more likely to cause fever than others. So for example, influenza virus is very characteristically associated with fever. And the fever of influenza virus is one that comes on very suddenly. It's a very dramatic presentation. Actually, an old-fashioned term for influenza was called the grip. And the reason that term was used is because the virus just grips the individual in this sort of envelope of unwell feeling and suddenly. And then body aches is another particular feature of a lot of viral diseases because of some of the chemical changes that occur in the body as you try to respond, the body tries to respond to those viruses. So I think those are the pretty characteristic symptoms: cough, sneezing, sore throat, fever, body aches, general malaise are the typical things that someone might experience.
So just as an aside, let's say someone just presents with one of those symptoms. Let's just say they have congestion. Should they be concerned? Should they go to the doctor?
Things that would increase my level of concern for which I would encourage somebody to be evaluated would be if they developed, say, nasal congestion that persisted over a 24 to 48 hour period and then was accompanied by some other symptoms. If the nasal congestion is there for a day, maybe feels a little bit better the next day and is gone, although that could be COVID and it could be some other respiratory virus, it's short-lived, it's not going to lead to a lot of concern. Relative to COVID, now that we have these rapid tests, I wish we had the rapid tests for all these viruses. You can do a rapid test at home and answer some questions about whether you have risk to others, because that's always a concern. But if the symptoms are really mild, relatively short-lived, I'm not going to be as concerned. And I generally tell folks you have a 24 to 48 hour window to see how things progress. But if you've gone past a couple of days, 2 days, and you're still, something's not right, it's prudent for you to get evaluated because of a couple of reasons. One, there's good treatments for a lot of these things. Two, you could pose a risk to others. The people that we mentioned who might be at greater risk than you could get sick because of your illness, and you want to protect them. And so I think that I use that kind of 2-day window in particular as a window of opportunity, if you will. Mm-hmm. Now, in that 2 days, if you've got a high fever, if you've got shortness of breath, if you have pains in your chest, if you're bringing up lots of respiratory secretions, phlegm, those are warning signs. and you want to make sure that you get checked, even if it's been in that 2-day window. But outside of those symptoms, I think it's okay to, sort of watch things for 2 days.
Great advice. So, big question, what causes all these viruses?
Oh, I'm fond of saying that the germs were here before us and they'll be here long after humans are gone. Viral diseases, bacterial diseases, infectious diseases are part of the human existence. And these virus diseases are not new. I think what's new is the ability of all of us to access information so readily and to become informed, which is great news. But it comes with sort of this question about, like, why didn't I hear about this before? Or where was this before? Gosh, if we just think about, historically, we just heard in the news about polio virus. Thankfully, that's not going to take over in the way that some of these respiratory viruses do. But, polio virus, measles virus, influenza virus, these viruses cause catastrophic epidemics, in the early 1900s. Because we did, one, understand them as well, two, we didn't have vaccines, three, we didn't have treatments. So viral diseases have affected humans for millennia. They will continue to affect humans, as will other infectious diseases. So I don't see it as particularly noteworthy as an infectious disease doctor that we have what appears to be these viruses. To me, what's noteworthy is the information era, which has really allowed us to learn a lot about these things for a lot of people. Mm-hmm. And the travel, international travel, has really allowed these viruses to spread in a way that they couldn't spread before. And so I think those two things are what's sort of given this perspective that all of a sudden we've now been overrun by many different new viruses.
Mm, okay, so let's talk about diagnosis. I know you mentioned PCR earlier. So is that the gold standard for all of these, or are there other options of diagnosis? Could you elaborate on that?
Sure. So yes, indeed, the PCR is the gold standard for all these viruses for a number of reasons. One of which is that we can now do this PCR testing, as I described earlier, for up to 15 different respiratory viruses on one nasal swab, which really makes the diagnostic process when someone has a cold or flu really that much easier. The flip side to that is that test, while readily available, and most physician offices, if they have a relationship with a large commercial laboratory, can access that test, it's not a point of care test, meaning it's actually generally not done in the doctor's office. It's done at a big lab, a hospital lab, LabCorp or Quest. And so you're going to wait a day for that result. You're not going to get it quickly. What we really would like is something to more like the rapid test we do for COVID, where you can swab yourself, 10 minutes later, you can read your 2 lines or 1 line. You hope it's 1 line and not 2 lines, that you don't have COVID, but you can tell yes or no, do I have COVID with this cold that you have? If those were available for other viruses, that would really, I think, be a big addition. We don't have those readily available as a test in the home. We have those kinds of tests for influenza and RSV in doctors' offices. Most doctors' offices, including our own, have the capacity to test for influenza or RSV as individual standalone tests. But the PCR gold standard tests I described earlier are really done in either large hospital laboratories or commercial laboratories.
Okay. So with all these viruses, then how are doctors treating them, and what are the treatment options available?
Well, the good news is that lots changed since I was in medical school. So when I was in medical school, we were taught there were no treatments for viruses. And nowadays we have treatments for many viruses. And so the science of antiviral medicines has advanced dramatically over the last 10 years. And indeed, there are many, many, many viruses that we now treat successfully, so many to cure, in fact. And so as a result of that, the methodology by which scientists are able to develop new drugs to treat viruses is actually pretty well thought out, and the processes for that are pretty standard. And so we were very fortunate that within almost about a year, maybe even less, of the onset of the recognition of COVID-19, 2 antiviral medicines were, one, identified, and then 2, quickly put into the clinical trial arena, and then 3 became available to treat people. Actually, it was 3. 1 was intravenous and 2 were oral. And so we had 3 drugs available to treat COVID-19 that actually work remarkably well. And you may have heard, some in the audience may have heard about the study this past weekend that was done in the VA. It was a great study that looked at the benefit of Paxlovid for long COVID, something that I'm very concerned about both for young and old. And there were dramatic reductions in risk of long COVID in those who got Paxlovid. We think that applies for any antiviral in COVID. So I think the point of that story is early treatment really dramatically decreases the risk of long COVID. But in addition, we have treatments for RSV that are potentially available, particularly for very compromised individuals, an antiviral drug. And we have several antiviral drugs available to treat influenza. So the big 3, if you will, of viruses that we're concerned about, each have their set of treatments that are potentially available for the greatest and the at-risk individuals. Key to that is, I should add, Serena, what's really important, and I emphasize this all the time, is that you must identify it early. And one of the biggest problems in thinking about treatment of viral diseases is the idea that I'm not so sick, let me just see what happens over the next day or 2. That's a mistake. And the reason is because if you wait to see if you're sick, it's actually too late to gain the benefit of the drug. And so it's really important that if someone is sort of thinking they might have one of these viral diseases and that they want to consider getting treated, that they get evaluated and request or look for treatment early, not waiting till later, because waiting till 4 days or 5 days is too long.
Yeah.
That study I mentioned in the VA was in the first 3 days, and that's really important for the audience to be aware of.
Yeah, no, that's a great point, right? And with RSV too, right? With kids, getting those children care right away is really very helpful in preventing, unfortunately, further illness or even death, right?
Yeah, further deterioration. It's a mistake to think I'm not that sick. You got to be treated early. Waiting till you're sicker you're waiting too long.
Yeah. Oh boy. So let's talk about prevention. What are some tips or prevention strategies you can offer to the community so that they can protect themselves from these respiratory threats?
Right. So we learned that really well in COVID, didn't we?
Mm-hmm.
And so what did we learn in COVID, applies for the 4 W's, right? So the same things that protected us for COVID, or that we used to limit our risk for COVID, it turned out they worked really well for influenza and RSV, right? We just talked about it. We hadn't seen influenza and RSV in 2 years. Yep. And all of a sudden they're now here. And the reason they're here is because thankfully COVID hasn't been as bad. Society has opened up a bit. And so all of the precautions that we had, because of our concerns around COVID, have really been relaxed. Thankfully, we're all happy about that. But what has occurred is that it has given the opportunity for these other viruses that may not have been as transmissible, and so therefore couldn't be transmitted with all the protections we had with COVID, are now being transmitted. So, watching your space, both the distance and the ventilation of the space, wearing a mask, washing your hands, and when you're sick, staying home, are the key principles of preventing transmissions of respiratory viruses. It applies, and the lessons we learned in COVID really drove that home for those of us who practice infectious disease medicine. Because like I said, influenza and RSV, it was almost as if they took a holiday. We didn't see those diseases in the last 2 years. And the reason that happened is because people were separate, people were wearing masks, and people were attentive to staying away when they were sick or ill, and being really careful about washing their hands, right? We're all using our, nobody goes anywhere without your alcohol hand rub, right? So, we're all doing that meticulously, right? So, so I think that has a lot to do with it.
Well, that's great. And, in talking to so many members of the community too, everybody's just feeling so burnt out from all these viruses in the world. So when do you feel like, will life go back to normal, and how do we get there?
Yeah, that's a difficult question. I mean, I think that the question really is not so much does life get back to normal, because I'm not in the prediction business. I think that one thing COVID helped me understand is that trying to guess what it's going to do next is almost impossible. And it seems like anytime I take a guess, I'm wrong. So I think that the point is that, and I stated that midway between our discussion today, germs have always been here. They've been part of the human experience forever. And so they're never going to go away. There's going to be new germs. We're going to continue to see that. There are always new germs. And so I think the real issue is, how do we improve our abilities to manage those, message around that, and limit our risks, because they're not going to go away. We're not going to get a society that's going to be germ free. That's not going to happen. And so that's the challenge. And, we have a lot to learn. I think we've learned a lot regarding that. But I think the main lesson is we've got to learn how to manage the message, manage the risks, and work together to limit those risks. Because I don't think that hopefully next summer will be a relatively quiet summer for us. But if we have another wave of some COVID variant, it wouldn't surprise me. So it's really a challenge to predict. There's no way to know. But we got to keep learning from these experiences.
Yeah, well, thank you, Dr. Nahass, for your insights and tips for everybody. We really, truly do appreciate it. This will actually conclude today's webinar. Please remember that the opinions expressed here by our medical expert today are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral service at 1-888-724-7123. And for more information about these respiratory viruses, please visit us at www.rwjbh.org. On behalf of Robert Wood Johnson University Hospital, Somerset, thank you, everyone, and have a great day.